To check for sensation, and we do this using a 10-gram monofilament that produces 10 grams of pressure against the foot to make sure that the patient has that ow response should they step on something. So basically it's a monofilament. You're going to make a C with it like this with your finger, or pushing down, and we'll be doing that on the foot. Before you begin touching your patient at all, you want to make sure that you clean your monofilament, and you use an alcohol swab. The alcohol swab you use is going to be, you're going to clean the top part of it, but most importantly the bottom part of it here that's going to be touching your patient. Alright, so you tell your patient, before we do this on your feet, I want to just make sure you know what it feels like. So it feels like a fish wire, and so I'll just, if it's okay, I'll do it on your arm here. Okay, so it's going to feel like this. Do you feel that?
Yeah.
Okay, great. When you feel that, you say yes. Go ahead and close your eyes. When you feel that on the bottom of your foot or on your foot at all, go ahead and say yes. All right. So the places that you push on are the places that your foot would naturally hit something. And so you can see on the picture here, you would basically do the toes, this area of the foot, and also on the heel. And then the top area of the foot here where the shoes might hit and might cause like a pressure problem. All right, so we are going to begin. So go ahead and say yes when you feel it. If you're making a C, 1 gram monofilament, 1 second off. Good.
Yes. Yes.
Notice
Yes.
that my hands are not touching anything else. You don't want to give the sensation anywhere else, so you always keep your hands away. Then for completeness, you would do that same thing on the other foot. And so you would say,
yes, 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 yes.
okay. The last thing that you want to do when you use the monofilament is make sure that you re-clean it again so it's ready to go. So you always clean before and you clean after. Have a look at the pedal pulses, and your landmark for both of the pedal pulses is the large toe. So we're going to do the posterior tibial, and so you find the tibia in the back, and you look for this bone here, and you're going to just use your fingers. I usually use 3 fingers. I kind of cheat, and I put a light sensation in, and then usually I can find it on one of my fingers. Yeah, so hers is right here. Very strong, excellent pulses, and it feels like something's kind of pushing against your finger. You want to make sure that you don't collapse the pulses by pushing too hard, but you can definitely feel you excellent pedal pulses. You'll do the very same thing on the other side, and so just for completeness, I'll double check. Yep, excellent pulses right here. The next thing we're going to check is the dorsalis pedis artery. And so the way you landmark that, again, is with the large toe. And what I do is I make a V with my 2 fingers, and I place that on the first and the third toe. And where my V connects is about where I'm going to feel the arteries. Again, I use 3 fingers, and I place that down right about where I felt that. And you'll feel a little feeling like that against your fingers. And she has excellent, excellent pulses. For completeness, we'll have a look at the other foot as well. Yeah, excellent pulses. Terrific.